where I get my daily reality checks.
Hello guys, I am Neil Correa, a second year MBBS student currently in my third semester. I'm coming by Travco, and today let's check out SEU. As you can see, we have entered the old building lobby of SEU, wherein from here we go on to our clinical classes. We either go to the clinical labs, we go to the histology dissecting rooms, or we even go to the chemical labs that are there in our university. Now we are going to check out the clinical rooms, over where we have our CAPS classes, that is your clinical and professional skills. Come on, follow me. These are your CAPS classrooms. Currently there are classes going on here, so we can't enter the classes, but you have your room 102. This is where we have a CAPS class under one particular teacher. It is distributed among 3 or 4 different teachers. This is clinic room or the medical center. We have more CAPS classes towards this side. We have a mock of OT over here. So now as we go down, we go into the simulation lab. Lab. This is where we have all our mannequins for different medical procedures. Come on, let me show you. Okay, so guys, my volume's a bit soft because there are 2 classes going on right now, as you see, towards your left and towards your right. I can't show you the students or the classes because of, permission reasons, but then never mind, I'll show you about the place. So as we enter, this is the place where we do blood tests, blood transfusions, or sometimes even chemotherapies and all. This is the table. These are your medicine cabinets for injections and all that kept throughout the lab. These are all simulated dummies. Basically, this is built to replicate a hospital. So as you can see, this is a dummy here, which is connected to a computer. And there are different simulations that have been run on this. For example, a patient's going through a seizure, so that is simulated using this. There's an air compressor that's connected to that. Then breathing sounds and everything is assessed towards these. Then you have different things. For example, you have a mannequin like this with an open thoracic region, wherein you can see all the organs, the functions of it, especially the lungs expanding, the heart beating and everything else. So throughout the room, we have different mannequins for different medical situations. If you move in here we have mannequins for the particular body part. This is your leg. We have like different bleeding simulations on this, then reflexes, knee-jerk movements and everything done towards these. These are all controlled by devices like this, which you can adjust what you want and how you want a particular situation to be. You have your bleeding simulations here of, say for example, you want to withdraw blood from a patient, you can learn how to do it on these mannequins. You have your meant to replicate veins and arteries, so you can just put in an injection and try to withdraw blood. This is actually a mannequin that represents how the baby sits inside the womb of the mother. This is now a simulation of the womb. This is how the baby is curled up inside. This is the surgical hand washing and surgical prep room. You can see here you have your surgical washing stations where you hand wash yourself. You have like a 15 hand wash that you have to wash your hands compulsory using these steps for every method, for every surgery or before any clinical aspect of your medical practice. So you wash your hands here. This is where you prep yourself. There are supposed to be showers here, but since this is a simulation, you can't really put a shower. But then yeah, this is where we wash our hands. We can adjust the temperature of the water, the soap dispensing and everything. And I need to push the switch. The water is on, then press it again to put it off. Okay, that is how these machines work. So guys, I hope you like the CAPS classes and all. This is state-of-the-art classes. and they have almost all sorts of mannequins programmed for different medical simulations. So anyways, now let's head on to the canteen. I'll show you all about. Come in. Guys, welcome to our SEU canteen. It is run by a Goan auntie who's really nice. She's been staying in Tbilisi for over 19 years now. She's a very sweet lady, very nice. She's Indian actually, she's from Punjab. She's just moved into Goa and then now she's here for the past 19 years. So this is what our canteen looks like. It is really spacious. It can accommodate over 200 students at once and the seating here is very good. The ambience here is very nice, very bright. And many students come here to study, to chill out, to get away, to escape from the busy day that they have. So guys, come on in. This is one of our anatomy lab. So as you can see here, we have different diagrams, different structures, plus we have a skeleton there. We use this, we have different teaching methods, like get a presentation on the TV, or we use screens like this, which we then get a whole 3D image of the human body. So this is our second anatomy lab. Guys, we learn based on this. As you can see these structures here, this particular structure, we can separate the head, we can separate the different parts of it, the muscles, the arteries, the connective tissues and everything to get a better look into this particular structure that we are studying. There are different diagrams placed all over the walls. As you can see, we even have a touchscreen TV. Plus we have another 3D TV over here, monitor, wherein we get a proper view of all the structures in a 3D way or in a standing fashion. So guys, come on in. Welcome to our histo lab, wherein we have a histology seminars done in these classes. As you can see, there are microscopes. You have your light microscopes present everywhere, wherein with these microscopes we learn how to view different slides, and there are a lot of slides kept in this very particular lab. We have a cryopreservation unit over here, and these are all our slides, our slide boxes. Our slides are kept inside these. Okay guys, so right now, as you can see, I have put on the virtual reality headsets and I'm looking into the heart. A really good teaching tool to look into the heart, to look into any body function and understand it very well. I'm inside the heart right now. I'm looking at the tricuspid valve. This is between the left atrium and left ventricle. Blood is being pumped throughout the body. Obviously you can't cut a live person and see the heart beating, but then through this I feel it's a really good way to understand how our body actually functions. And in the future, if you'll ever get a chance to do these classes, I highly recommend you all do this virtual reality classes because it is very beneficial. You will learn a lot. Something my teachers couldn't really show me in person, I'm actually getting to see it through technology. It is very beneficial, it is very helpful, it is very good. Structure moving towards me. You can see the sternum bone, you can see vertebrae and all that. You should do these classes, it will benefit you all a lot. Hello guys, so now currently we are on the bridge. We are going from the old university to the new university. Anyways, my experience here in SU, it's been a year now. I'm in the second year anyways. But yeah, I had a very good experience. I mean, I learned a lot. It was a dream come true, first of all, studying medicine. And then studying in a university like this was a game changer. SU is better for its own reasons. Firstly, being the liberty to select your class seat, the friendly teachers here, and place here, the ambience here and all is really nice. And the aesthetics here also are very good. And it's also close by to where I live in Isani, and the airport also is really close, so I feel this place is a prime location, is a very good university according to me. Many people have their varying opinions about it, and secondly, I have enjoyed a lot. The functions here, the programs here are very good. I've learned a lot also. I've learned from different trained professors, trained specialists in their very particular fields and all that, and it was a really good decision coming to Georgia, coming to SEU especially. A big thank you to Travco for suggesting me that, but then yeah, I had a great time. Cheers guys. This is how our new university lobby looks like. You'll be having different functions over here. For example, a Diwali party, a freshers party, cultural events, everything will be held down here. This is our stage. Our graduation also will be done in this very particular area. We have different conferences, different job fairs, different activities that have been done over here, and that will be done in this particular place. Come on, let's check out. welcome to the 6th floor. This is one of the floor where you'll have your classes, your medical classes obviously. And so these classes, if you see towards my right, these are your seminar classes. So you will have your seminars here every day and depending on your timetable. So in these classes, out of your big group, out of a chunk of 600 students, you might probably be divided into a smaller group. And from that smaller group, you will get your lecture classes. From that group, you will be divided into smaller groups of 20 students and you will have your seminar classes over here. So in this seminar classes, you will be quizzed, either graded for your presentations or for your orator skills, for your clinical skills, and you might have classes also over here where your teachers will explain you the topics and you'll get a one-on-one attention with your teachers. Hi guys, so now we are in the library. We are going towards the library. So my voice will be really soft. I'll be talking in whispers. So let me just keep the mic in my hand. Test, can you hear me? Check, let's go in. Come on. Shh. Before the librarian comes and anyways, it's very spacious as you can see in the videos. It is really quiet, pin drop silence. That is what is maintained, and the study environment is perfect to study and even to sleep. Obviously, it is really good. You can't bring eatables in here for obvious reasons. Whenever I need to study for a quiz, or if I just want an escape from the noise and from the loud, I just come here and I sit and I study. It's really peaceful to study, and it creates a very nice environment for the students to sit and focus on what they have to. I mean, studying is the most important thing we're coming here to do. So the best place to study is the library, and I feel it is maintained like a well-maintained library, SEU library. And I've been to different other universities and I feel I like this library more because it's more spacious, more comfy to the students, and the environment out here is really good. Usually we use ebooks, but then if I want any physical books, we can just access the library at any time and get a record of the book that we need. Since you're a student here, you are automatically enrolled to the library, but you need to make a pass in the start, and you get the books. You can take a book whatever you want, just like how a normal library works. Who says medical students don't play sports? Yes, we do play sports. We have a badminton tournament going on right now. So guys, that was SEU. I hope you liked it very much. So for all the students coming here, I'll suggest you all keep an open mind and always have courage. Don't be scared of anything and have confidence. That's the most important thing, because confidence will take you to places, and try to market and try to network yourself more and get connected with different people. It will help you all very much. That's all I have to say. Enjoy guys. And wishing you all the best and hope to see you all here soon.